For me, it will enable nurses to practice with confidence that they are following the same journey as medical colleagues and allied health professionals. So we have a consistent way forward in dealing with that patient and the care of that patient, which again gives the patient confidence that everybody's talking of the same language. So what it does do, it enhances our professional practice and most importantly the multidisciplinary working, which is key and is so dependent in healthcare.
So clearly good in theory, but do you think nurses have an inclination to use the map of medicine?
I think inclination is the wrong word. I think nurses are using it and will use it. Because what it does do, it actually ensures that they actually follow that consistent journey. It also means that doctors and nurses have had to sit together to actually talk about the pathway development in the localisation. So there is some ownership. It's also an education tool when they're designing the pathway, because there's the rationale of why each step in the pathway that they're taking. So you start to enhance people's knowledge and skills and then the confidence that they're applying that pathway in a cohesive and consistent way.
So would you say one of the benefits was that it's creating a common language between different health practitioners and different levels of healthcare?
Absolutely, and then what it also will do is enable people to know what each other's role and contribution is, and therefore, you know, if something doesn't happen, you'll be able to pinpoint why something didn't happen. Right. And at the end of the day, the patient will feel confident because everybody will be speaking of one voice, and it won't be, you know, someone saying something and then someone contradicting it, because it will be one journey for everybody.
You're also a commissioner. What are the benefits for commissioners of the map of medicine?
I think for commissioning, for me in commissioning, and I also carry the quality agenda in my PCT job, and what it enables us to do is that we can ensure that there is a cohesive journey for patients. So we will be clear what primary care should be doing, and that's doctors and nurses in primary care. We will be clear what our hospital consultants and nurses will be doing, and we will be clear in the aftercare that people will need for that continuation. So therefore you'd be able to commission each part of the pathway in a joined up way. If I'd like to add, because what I am quite adamant is that we don't use the map of medicine as a commissioning tool. It's a tool for clinicians to aid professional practice, which will support commissioning, and that's quite important. It will inform commissioning, but we really must keep this as a clinical tool, because the advantages is about safe practice and not for widgets that we're going to purchase.
You've been seconded previously to the Department of Health on a prescribing project. Are there benefits, do you think, for prescribing?
Absolutely. Prescribing is dear to my heart, and if you read the National Patient Safety Statistics, and we treated how we give medicines like the airline industry, all planes would be grounded, wouldn't they? So I think this will give us straightforward guidance, protocols through all the professions about the most appropriate medications of and the interactions that can be given. What it also does is ensures that we actually do the investigations and diagnostic testing, which may be necessary to ensure that either the medicine's right or the continuation of that medicine is appropriate.
And how do you think it should be measured, the success of the map?
I think what we'll start to see consistency in professional practice. If there are errors or adverse events, we would start to monitor and measure why they haven't used the pathway, what part of the pathway they didn't use and why not, and therefore people will be called to account in relation to that. I think through our regulatory bodies, for me, Nursing Midwifery Council, they already, when there's a case of poor practice or fitness to practice, they will look at what is the protocols, theories that you were practicing to. Now, if the map of medicine is shown to be good practice and it's not being used, we will be asked, one, did we know about it? If we did, why aren't we using it? Is it used in our local organisations? And if it is and we haven't used it, you'd have to have a very, very good reason of why you've not followed that process. But I think as doctors and nurses start to use it and work together in partnership, they will gain, the credence of the map will continue to grow.
Is it something that you would like to envisage patients using at some point?
I'd love to see patients use it. In this patient-centred NHS, how powerful to have these the maps in patients' hands who can say, well, this is the pathway I should be following. Why aren't I following that journey? You know, what's going to happen to me? Because people like to be in control of their lives. Information gives them that control, and I think the map will actually enable them to stop getting lost in the system and plan their route. And it's interesting, when you go on a car journey, you get a map out and plan your route, and yet we expect people to come to give their bodies to the NHS, and they never know when the journey starts or when it ends or which point what will happen, and that clearly shouldn't be right. So the map would actually assist in that knowledge for patients who actually can take real control.
Barbara Stuttle, thank you very much for your time.
Thank you.